Shannon, what's the First Nations Health Authority doing in the wake of this pandemic?
Starting in mid-January, we stood up a team that we're calling our First Nations Public Health Response Team to start the preparations, knowing what was happening in other places of the world, understanding our risk, and beginning to work on some of the preparations. Since that time, we have now moved up that team to a level 1 response, understanding that there are community-acquired cases in British Columbia and that we need to do more.
How many confirmed cases are in British Columbia right now, and are any of those presenting risks to First Nations populations at this point?
As of yesterday, there were 94 confirmed cases. We know that there are a couple of thousand actually test tubes that need to be tested, that are in a queue to be tested, so the number is probably really underestimating the true impact. Just like every other citizen in the world right now, First Nations are at risk, especially individuals who don't have access to great resources for personal health care, for hygiene and others. We think particularly of some of our urban populations, the significant number of individuals who are homeless in our urban centers, and as well our elders and those with chronic disease or impacted immune systems in our communities. So because there's so much traffic in and out some of our communities, we're being really conscious of making people aware of the risks to those individuals and to plan for them.
Those people particularly at high risk or who don't have access to good sanitation, what can those people do to prevent getting sick?
Right. So I've done a bit of research over the weekend because it was a question that was raised to me on Friday about communities with boiled water advisories and what do they do about hand hygiene, for example. What I've been able to find is that there are several different sort of levels of risk that water issues can present to a community, and there's a difference between a drinking water advisory, which may be a boil water advisory, and a do not consume advisory. So in the cases of a boil water advisory, either boiled and cooled water can be used for hand washing, or just the water out of the tap with soap are sufficient to kill the COVID virus. It's still recommended that people use hand sanitizer if they have it available as well. For communities that have the do not consume advisories, the rules are a little bit different, and in those cases, most cases, the water is shipped to community for drinking purposes, cooking purposes, and now that would also include hand hygiene purposes.
Excellent. Shannon, thanks so much for that valuable information and for taking time out of your day to share it with our audience.
Thanks, Melissa. It's good to talk to you.